Welcome back. Today we are talking about something that can happen to anyone. Heart attacks. It's important to know the signs, but also your risk factors. So, to learn more about this condition, let's chat with Dr. Chris Paris from the Cardiovascular Institute of the South. Hello, Dr. Paris, or should I say bonjour with a last name like that?
Is that we're all the same from born and raised down here. Thanks for having me back.
Yes, thank you so much for coming on. I am so glad we are talking about this because, like I said off the top, this is something that can happen to anyone. Anyone is at risk for a heart attack, but there are some groups who are most at risk. Please tell me a little bit about those groups.
So, cardiovascular disease, the number one killer in the world, in the United States, developing countries. So the people, everyone's at risk, but the majority of risks, there's three what we call modifiable versus unmodifiable risk factors. Your non-modifiable risk factors are your age, your gender, and also family history. And when we talk about family history is having a significant cardiovascular event, heart attack, stroke, for men before the age of 45, and for women before the age of 55. So that's your family history, your genetics, you can't change. Yeah, modifiable risk factors, you can see diet, exercise, smoking, diabetes, obesity, the cholesterol levels. Those are your modifiable risk factors. But depending on how many risk factors you have, increases your risk of having your first heart attack or cardiovascular event.
Unbelievable. And for people watching out there right now who may fall into these groups or categories, what are some of the symptoms they need to be looking out for when it comes to having a heart attack?
So the major symptoms, if you read the book, is elephant sitting on your chest, radiating to your left arm. Your left arm feels like it's in a vice grip, sweating, nausea. But anything, it's any type. We usually don't say chest pain. We say you're having any chest discomfort, because it can be anything from a squeezing, burning, stabbing. You can get cool, calm sweating, shortness of breath occurs, nausea and vomiting at times, dizziness, unexplained weakness, irregular or rapid pulse rates, what we call palpitations. Any of those, you can have one, you can have them all, or it can pick and choose. But basically, pain from the top of your head to your waist, if it's something different, needs to be checked out.
So true. What's interesting about this condition that we're talking about is that men and women sometimes experience different symptoms. How do women's symptoms differ from men's symptoms when it comes to having a heart attack?
Yeah, we found this out just recently, within the past 10 to 15 years. All the majority of studies were done on men. And we just all assumed the sexes were the same. But as things progress, we start to see there's a little different. Women don't always experience symptoms, or their symptoms could be milder, more subtle. They don't have to have chest pain. They can have a little mild discomfort, ache, and then they can experience different things going to the jaw, the back, in between the shoulder blades. They can have abdominal pain. Men can have these symptoms too, and women can have men's symptoms. But for an overall, the men usually go by the textbook, because that's how the textbooks are written from the old studies. But we're seeing women have atypical symptoms from previous, but more subtle symptoms overall.
And why is that? Is because of different hormones?
We think it's more about genetic. We still, we know men and women are different. Just like all races are different, gender are different. So no one group can be comfortable with another group. So that's why all the studies are that we study each individual gender and race, because everyone is different in one way or the other.
Very interesting. Now, Doctor, I want to ask you this because this is a new term I just found out from getting ready for this interview today. A silent heart attack. It is a real thing, people. What is a silent heart attack, and how do we know we're having one if it's silent?
So we call it a silent heart attack because we find it out when you come into the hospital because of progressive symptoms. So silent heart attacks are things that start over time. They're not immediate. It's usually a block that you have that's getting bigger and bigger, but slowly over time. Your body wants to live. Your heart's an amazing organ. It's God's greatest gift. So it will fight it will do everything it can to stay going, diverting blood. But over time, if your heart keeps on needing more blood and it can't get enough blood, parts of the heart will start getting fatigued and can start dying away. Now, if the heart gets injured, it can repair itself. But if it gets killed or scarred down, then the heart becomes non-functional. So over time, your heart gets to a point where it says, no, Moss, we need help. And that's when people present to the hospital and we find, oh, look, you've been having what we call angina. That's where you hear the chest pain, or some people call it angina, but you've been having an angina and people just been blowing it off. So never blow off any type of symptom. And the biggest symptom people blow off is just fatigue. They're like, oh, I'm just always tired and blaming it on age or weight. But fatigue happens over a year or two. If you're more fatigued now than you were over the past 2 or 3 months, that's something you need to look into.
And Dr. Paris, before we wrap this up, I want to ask you real quick, is there any way to prevent a heart attack? I hear people saying, take an aspirin. Is that true?
Yeah, so the aspirin debate back 10, 20 years ago, we said everyone should take an aspirin. Well, now we find in the data that we're starting to see what groups can take it, what should take an aspirin and not. Now, if it's acute heart attack, you think you're having an acute heart attack, the best thing to do is either get 4 baby aspirins or 1 big aspirin. The baby aspirins are 81 milligrams. The big aspirin are the 325s, and chew one. You want to chew it and swallow it. I guess the best. And call while you call 911. That's the best thing you can do for anybody if you think you're having a heart attack or a cardiac event.
That's a great tip right there.
Yeah.
So keep an aspirin in the medicine cabinet. Look, Dr. Paris, I could talk to you all day, but we've got to go. Look, if you feel like you're having symptoms of a heart attack, head over to Cardiovascular Institute of the South. Or if you have more information or more questions about heart attacks, visit cardio.com. They are located at 107 Maryland Drive in Lublin.